talking about having these monies back and how we'd feel about it, you asked the right question, saying that we'd have to feel the direct impact of these funds being repatriated, because we can't just say that, okay, these monies are coming back, and then the common Nigerian on the streets aren't feeling it. So for me, I would like to see this current or this incoming money, this $150 million, to be deployed into other areas aside from infrastructure. This is why I say that. Now, over time, we've always heard that the monies have all gone into infrastructure. You're trying to build a bridge, you're trying to repair roads, fine. I'm not saying investing in infrastructure is bad, okay? But like I said at the beginning, we must also be able to feel the pulse of the Nigerians on the streets. Now, with the way things are economically, with the harsh realities we're facing, we cannot sustainably say that we're giving our palliatives, right? So how about we see this particular tranche of money be invested judiciously in the education sector and in the health sector? Because you can say that we're...
transportation.
And possibly transportation as well, because those are the areas where Nigerians will feel the true impacts directly in the shortest possible time. If you're saying you want to deploy it for 4th Mainland Bridge, when is that going to be done? With the current realities we're facing, so the government must really, they must pay attention to the current realities of what is going on with Nigerians right now, and see how they can deploy these monies as soon as possible into these very sensitive areas. All the areas I've talked about have respective ministers at the federal level where they oversee ministries. By now, I would expect that they've gotten various reports from their counterparts at the state levels, and also to see what's on ground at the federal level. So they should be able to give the president certain bullet points, say, okay, you know what, whatever you allocate to us, this is how we break it down, this is where it is going to. But we must be very deliberate with how we deploy these resources, or else we will keep having this same disgruntled attitude we have towards this particular conversation. And frankly speaking, this is not the time to have it, because a lot of people are desperate, a lot of people are angry, a lot of people are hungry, a lot of people are discontented for various reasons. So we must see how we show the people, from the government side now, that they understand the plight of the people and that they can relate to what Nigerians are going through by deploying this particular tranche of money into these areas we talked about: health, education, and transportation as well. Those are the areas where Nigerians will feel it very, very directly. You have general hospitals, upgrade them very well. Don't have people go to general hospital and then the patient is the one who has to go and buy syringe, buy drip, buy all of that. No, let's have these resources deployed where they should be deployed, into transportation. Let's see how we can have the mass transit back into the educational sector. Let's see how we can get qualitative education, have schools built with furniture in it, and have teachers trained from it. So these are things that the common man can feel directly.